There are 15 individuals in hospital, of whom 2 are in intensive care units around the country, and we have conducted over 2 million tests for COVID-19. To provide some detail as to the distribution of those cases around the country, in New South Wales, to 12 noon today, there were 5 cases diagnosed, all of whom had COVID-19 acquired overseas and remain in hotel quarantine and isolation. In Western Australia, there was 1 new case diagnosed, acquired overseas and in hotel quarantine. In Victoria, there have been 19 new cases diagnosed to 12 noon today. 3 of those were acquired overseas. 4 of those were acquired locally and linked to a known outbreak. 10 cases were locally acquired and not linked to a known outbreak, and 2 of them are currently under investigation. Now, you will have seen over the past 24 hours that the Victorian Premier, the Victorian Health Minister and the Victorian Chief Health Officer have provided updates extensively on the current situation with regard to coronavirus in Victoria. And the Australian Health Protection Principal Committee met today to receive an update from Professor Brett Sutton and colleagues from the Victorian Government Department of Health and Human Services on the current epidemiology of cases in Victoria. Now, it is a timely reminder that in a population that is non-immune to the virus, to COVID-19, that we will get from time to time outbreaks and clusters, as we have seen in Victoria. It is certainly the case, though, that in the past week we've seen 116 cases diagnosed in Victoria, up from 35. So it is clear that the numbers have increased in Victoria, and as the Premier and Health Minister expressed, those numbers are of concern. And we note that the Victorian Government has recommended that household gatherings once again be limited to 5 individuals. Again, a timely reminder that, as all Australians, there are restrictions on how we live that we have really done well in pursuing, but that those will continue whilst we remain non-immune to COVID-19, whilst there is not a vaccine and not an effective treatment, and whilst cases continue to increase around the world. And that those restrictions have and will be critically important to the control of the virus. Importantly as well, for those states where restrictions are lifting, that doesn't imply a lifting of our personal behaviour standards that we've become so used to. So the critically important elements to stopping the virus transmitting from one person to another, excellent hand hygiene, downloading the COVID Safe app, keeping our distance where we can, and importantly paying very close attention to our own symptoms and that of those around us. And certainly, if we do have symptoms, not engaging in the community, not going to work, and ensuring that we get tested as soon as possible. All those elements have been exceptionally successful in controlling COVID-19 in Australia thus far, and there is no reason to expect that that will be any different into the future. And I'm happy to take questions. Jane.
Today's meeting with the HPPC, were there any recommendations about any changes to social distancing? We know that the Victorian CMO recommended well, he was going to look at face masks, for example. Any new advice on the wearing of face masks?
So face masks were discussed today at the HPPC meeting. The position on face masks in Australia has been clear, that in circumstances of low prevalence, and we should note that it is still a low prevalence environment. Even though there have been an increase in the absolute number of cases in the Victoria associated with those outbreaks, the overall numbers remain low. So the position that we have taken as the HPPC on face mask use in particular remains the same in this circumstance where we only have very low levels of community transmission, that the value of face masks in the community is limited, and that recommendation hasn't changed.
On border closures, has the HPPC's position on that changed, given that obviously the spike in Victoria won't mean that anyone in WA is going to be affected because that's a hard border closure? Are you still recommending that there's no medical grounds to state border closures, and they don't have any value in circumstances where we see such outbreaks.
So I think the question implies that the AHPPC had or will have positions on border closures, which, as you know, we do not. That is a matter for the states and territories and their First Ministers and relevant departments, so we don't have anything to add to that.
The increase in cases in Victoria, though small comparatively, they're overwhelmingly community transmission. They're not overseas returned travellers. Given we're now exactly 2 weeks after the Black Lives Matter protest, can you confidently rule out that there are eventually going to be connections that link back to those mass gatherings?
So I just contend with the word overwhelmingly. There's a majority of cases that are community transmitted, about 60%, as opposed to hotel quarantine, which is now 40%, and that's a reversal of the previous statistic over the past month or so. So there's still a large number of cases in Victoria that are being diagnosed through hotel quarantine. There are 3 cases that have been diagnosed as people who had COVID-19 and attended the Black Lives Matter protests, but there's no evidence that there has been chains of community transmission that we're aware of through the Black Lives Matter protests.
We have at least 10 people who don't know where it came from by process of some people not having very prominent conditions present. They could have spread from those gatherings.
So the contact tracing, as you know, is a very, very rigorous process. That those cases, whilst we don't know where they have come from, the contact tracing will include genomics and will use genetic genomics to assist us in determining where they came from. But there's no evidence from the extensive investigation that Victoria has undertaken that those cases are linked to the Black Lives Matter protests.
On borders again, I mean, the AHPPC doesn't have position, but it has had advice that there's no medical grounds for state borders to be closed. Will that advice be revised at all, or does it remain that the advice is there's no medical need for state borders to be closed?
No, in actual fact, I'll repeat my answer to the previous question, which was the AHPPC actually hasn't had a position on border closures. We've never made a recommendation on border closures. There's been some individual commentary from officials on the need for border closures, but the AHPPC actually hasn't had a position on that, and will continue to leave that to state First Ministers.
On the easing of restrictions, we're obviously seeing Victoria, I guess, put a pause on what they were going to do. Should other states be considering putting a pause on their easing of restrictions? I mean, is this one of these moments where we sort of have to go catch our breath and go, okay, let's just see and see what's happening, rather than continuing with the stampede to open up the economy?
Well, again, I'd contend with a couple of those words. I don't think at any point we would have viewed our lifting of restrictions or opening up of the economy as a stampede. Everything that we've done has been in a safe and cautious manner, in a proportionate way. And similarly, we've made it very clear that states and territories will make their decisions based on their local epidemiology. So it would be unreasonable for WA or Northern Territory, or indeed Queensland at the moment, to be making decisions on their restrictions necessarily with a close eye on what's going on in Victoria, because the epidemiology is different. And as you see, as the epidemiology changes, albeit slightly in Victoria with an increase in the number of cases, so too has the Victorian government come forward and made recommendations to reimpose those restrictions on the number of people that you can have in your household. So I think this is a good example of how things are going to work into the future, and you know, it's an important example because it will show how a state can get on top of outbreaks of this nature in Victoria, and then move forward.
Doctor, on COVID treatment, just looking at a recent trial of NHS patients out of the UK, does Australia have a stockpile or have access to Dexamethasone, or is that something the AHPPC is looking at?
So dexamethasone is a steroid, a corticosteroid. It's a oldish drug. It's in wide circulation and wide use. It's not something that we necessarily feel we need to stockpile because it's in such wide use and it's so available. So keeping in mind that dexamethasone is not a direct-acting antiviral, it doesn't actually do anything to the virus. It sorts out the complications of the inflammation that's associated with it. So it's the recovery trial, they are promising results. We look forward to seeing them replicated in other trials, but we're not aware of any shortage of dexamethasone at the moment.
Dr. Coatsworth, you talk about personal behaviour and responsibility. These clusters around family gatherings or in-home gatherings still pale in comparison in terms of the size to the Black Lives Matter. If we did get off lightly with those large protests, are you worried that that created complacency elsewhere in the community? They saw those big protests with limited cases and had larger gatherings at home.
Oh, well, that would be very hard to conclude. I mean, I haven't interviewed the people in that particular cluster, and I don't think that question could necessarily be inferred that it was the Black Lives Matter protests that then led to people gathering in household clusters. I think what's going on, and what's going on around the world, is that there is a certain amount of time that we can cope with these restrictions on our lives, and people in general, whether it's getting out and going to a Black Lives Matter protest, or whether it's going to visit your friends and relatives. These are things we do as human beings. So I think that's more what we're seeing at the moment. And I think the message just has to be abundantly clear that we don't want people to stop living their lives. We want people to interact, but we want them to do so in a way that is safe and stops the virus from spreading. So I think it's probably a nationwide thing that we want to get out and do what we do as humans.
The Health Minister this morning was saying that premiers who are taking a more cautious approach overwhelmingly are doing the right thing to be safe rather than sorry. I understand what you said in terms of the epidemiology of, say, Victoria. That shouldn't affect what WA does, but maybe it should affect, obviously, in terms of our border restrictions. Do you agree that it makes sense for us, WA, to take a cautious approach in those sorts of matters? That does just simply make sense?
Well, I mean, I think we've got to, we're a continent, and we've got a certain situation in Victoria at the moment that will naturally play into decisions around Australia. But I guess the point of my previous response was in terms of the number of people that you can have in a gathering, the number of people you can have in your household, the number of people you could have in a pub, that is still going to remain different from state to state, and the states will make those decisions based on their own local epidemiology, which is completely appropriate.
What's the advice on hugging and handshaking? Is it still a no to both of those?
Well, that's certainly my personal view. I mean, I think these are the sort of things that have to stay the same. That can't change. There are various things that help us transmit the virus, and very close contact is one of them. So it's a hard thing to remember. You've got to catch yourself out now when you see your friends and family who you haven't seen for a long time. But these things are nonetheless important, and are arguably far more important than say wearing masks. I mean, the social distancing measures like washing your hands, like keeping a distance, like not hugging or kissing, and like staying at home when you're actually unwell, that is the mainstay of what we can do as individuals. That's the personal responsibility element. And then there's the restriction element that the governments recommend that we do. I think I've got one on the phone, and given we've all had one go, we should. Thanks, Tom. And the question reflects to the COVID-19 positive case within the Essendon Football Club, and whether there's any substantive differences or indeed how you might go about contact tracing of an individual within a sporting club that was COVID-19 positive. And I think, Tom, the answer is that it's tempting to take these sort of high-profile cases and consider that there might be a different approach. There's certainly not. A close contact is a close contact, and that definition is 15 minutes or more at a distance of 1.5 metres or 2 hours in the same room. So, you know, the contact tracers, the disease detectives, will be applying those criteria to this case, just as they will for all the other cases down in Victoria. So I think it's important that we let that sort of public health investigation take its course, and I'm sure we'll hear in due course what the outcome for the Essendon Football Club will be. I don't have any more particular information on that case.
Can I just clarify? So for the states, for the other states, they can continue on the path they're going in terms of easing restrictions and things like that. There's no need for a pause or a 2-week reassessment period until we see what happens in Victoria. Other states are free to keep opening up.
No, look, the message is that each state will have their restrictions dictated by their local epidemiology, and they will continue to do that. So whether how much of an eye they have on Victoria will be entirely up to them. It is, you know, I think it's an important thing to say that each state controls their own public health unit and decision making, but all of us in Australia want to see the outbreaks in Victoria brought under control, and as a result of the meeting today of the AHPPC and the update from Professor Sutton, we have every confidence that that's going to be the case. I'll take 2 more.
Dr. Coatsworth, some of the cases in Victoria related to people who were ill going to work, or people who had been confirmed COVID then interacting with others. You've stood here dozens of times and told Australians to exactly not do that if they are sick, to stay home. Are you disappointed that that has been disregarded so quickly and at such a crucial time in the easing of restrictions?
Look, I'm not disappointed at all, because I don't think in those cases in any way, shape or form it's individuals deliberately going against what we've said without a broader context to why that decision is being made. So let me give you the very clear example of doctors. We go to work when we're sick all the time. We have done for years. We've even got a term for it. It's called presenteeism, not absenteeism. And there's a whole range of reasons why someone who is sick may turn up at work despite being asked or it being recommended that they don't. One of those, of course, is that there are people who don't have sick leave. There are people in casual employment. There are a lot of people around the country who are suffering socioeconomic stress at the moment. So the important thing then is to recognise that and work out what we can do to assist people so that they don't turn up to work when they're unwell.
Last question. Just to make this clear, I accept that the HPPC doesn't have a position on state border closures, but the Resources Minister, as early as this morning, and the Prime Minister repeatedly says that the medical advice is borders should not be open. Should Commonwealth ministers not be saying that anymore?
No, I think obviously as a health official, I'm not in a position to say what Commonwealth ministers should or shouldn't be saying. What I have said, though, very clearly today is that it is not the AHPPC's role to be making decisions about national borders.
But what medical advice are they talking about then? If you're saying that the HPPC doesn't have a position on borders, what medical advice are these ministers talking about?
Well, the HPPC simply hasn't had a position on borders, and it is up to the states and territories to make decisions about their borders. That's what the Federation's about, and we'll close the conference there. Thank you.